Welcome back to Today's Health. In this segment, we're going to talk about robotic-assisted surgery with the robotic specialist at McLarenport Huron, Steve Schlitt. Steve, thank you for joining us today.
Thanks for having me.
Now, tell us more about the robotic surgical system that we use at McLarenport Huron.
Absolutely. Currently, we have the Da Vinci SI surgical system and the XI Da Vinci surgical system. We started off with the Da Vinci SI in 2012. We did cases starting in March, mostly doing gynecological procedures, hysterectomies, and we slowly progressed into urology doing prostatectomies as well. General surgery didn't start coming on board until about the end of 2015. So for those first 4 years, from 2012 to the end of 2015, we did about 480 surgical procedures. Fast forward to today, now that we have 2 surgical systems that we just acquired, the second one in October, we are on pace for, in 2017, to do 475 cases alone in 2017. So you're looking at 480 cases those first 4 years we had the robot, to now in 2017, we're looking at doing 475 just for that year alone.
So it sounds like the surgeons have really taken to this procedure and are using it for much broader cases.
Yeah, they have adopted it, as well as the general surgeons, like I said, and having that second robot for us means that we can get patients in quicker, the doctors can use it more often and not have to change their approach.
What a benefit to the community to now have 2 robots that are available for minimally invasive procedures.
Absolutely.
Now, we often don't think of this, but what are the benefits to the surgeon of using this type of robot for surgery?
It's a good question. The benefits to me in talking to the surgeons is, with open surgery, it benefited the surgeon in the fact that they got their hands in there, they got to feel, they got to touch, but the disadvantage was in the patient. They had large incisions, risk to infection was higher, longer recovery times. Then laparoscopic surgery came out. A little bit more difficult for the surgeon, just because of the small ports, using the monitors instead of having the touch and the feel, using rigid instruments, and then the Da Vinci came on, and it's an advanced form of laparoscopic. So I like to look at it as it kind of gives a surgeon the open feel, but with a laparoscopic approach. So I think it's like a win-win for the doctors and for the patients as well. And with the Da Vinci specifically, as far as the laparoscopic portion goes, it gives them the 3-dimensional image of the field, whereas traditional laparoscopic is 2 dimensions, looking on a monitor at the surgical site and using rigid instruments that don't really bend or flex as much. With the Da Vinci, it's a 3-dimensional image, like I said. It's 10 times magnified. The instruments are flexible, they have wrists, so it allows them to reach places that they wouldn't normally be able to reach, with a lot more ease of sitting at the console and controlling the robotic instrumentation, as opposed to standing at the bedside and kind of moving those instruments around for what can be up to several hours at a time.
So that sounds like it's a lot less stress physically on the surgeon as well, to instead of standing with their neck down, to be able to sit comfortably at the Da Vinci. And they also can probably even see better than they could if they were standing right next to the patient.
Yeah, it's being able to have that scope look directly at the surgical site. They have control of the camera, all of the instruments at the same time. It really gives them a view that they kind of have to adjust to at first when getting first acclimated to the Da Vinci system.
Now, what other types of procedures is the Da Vinci used for?
Right now, we started, like I said, with gynecological procedures. Urology is also using it with prostatectomies. We now have thoracics surgery going as well, doing lung resections for cancer, as well as general surgery is the big focus right now with hernias of all kinds, and we're starting to do some bariatrics as well.
Now, you hear a lot about a lot of hospitals having robots, but what sets McLarenport Huron, apart from the others and having the Da Vinci system?
There's a lot of talk about robots. When I go out and have questions asked towards me, a lot of people are like, "Oh, I had my knee done with the Da Vinci surgical system." And it's kind of important to say there are a lot of robotics out there in the surgical world. It's a very good thing, but at the same time, it's nice to kind of differentiate the 2. There are other robots, as we said, but the Da Vinci surgical system is doing a lot of the cases that we discussed today. And it's just important to know what options you have in the area and kind of understand exactly what you're getting done. So the fact that we have now a second Da Vinci system offers more availability to our patients. They're not waiting as long for their procedures to be boarded. The doctors don't have to board 6 weeks out in advance. It's happening more frequently now. So it gives the surgeon, it gives the patient just more opportunity to have the benefits of the Da Vinci surgical system for their cases.
Now, what are the known benefits for patients who choose to have surgery with the Da Vinci?
Very similar to a laparoscopic, because it's important to know that the Da Vinci is a laparoscopic procedure. It's just using the robot as a tool for advanced laparoscopic procedures. So there's less scarring, less blood loss during cases. They have less pain post-operatively, so they're going home quicker. They're on less pain medications. And just overall recovery time is better for them.
Probably just getting home and getting back to normal life a lot quicker.
We all want to get out of the hospital and get home and healing, and I think the Da Vinci offers that quicker.
Steve, this has been great information that you've shared with us today. Thank you for joining us.
Thanks so much for having me.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLarenport Huron.